We're going to talk about the big M. Dr. Demystified Gray, what is menopause? Do men experience menopause? So when women say, I'm having a personal summer, is that a hot flash? Can we talk about mood swings?
Sex is painful, so she's moody. Something's got to give. So menopause can be very hard on a marriage.
This is some great information. Your copay can't even pay for this information. This is something that we should share.
Good afternoon. Welcome to Mahogany Tea Time. We are so excited today. We have a guest on the show today, Dr. Demystified Gray, and I'm sure many of you that are local have heard of her. She's probably your doctor. Dr. Gray is a board-certified gynecologist here in the Dallas-Fort Worth area. She provides exceptional patient care, and she's been doing this since 2005. She's passionate about women's health care. Dr. Gray says that her goal is always to make a meaningful impact on the lives of her patients. Welcome, Dr. Gray. We're so excited to have you here.
I'm happy to be here.
Welcome. I love that beautiful smile.
Thank you.
Isn't she pretty?
Yes.
Okay, so Dr. Gray, today we're going to talk about the big M. And a lot of you are probably like, what is the big M? Guys, we're talking about menopause. I know many of you have heard of it. A lot of you are probably going through it. So the first question of the day, Dr. Gray, Dr. Demystified Gray, what is menopause? Would you tell the people?
Yes, so menopause is when a woman stops ovulating and then no longer has hormones produced by her ovaries.
It's just that simple.
It's that simple. It's just a stop in the production of hormones by the ovaries.
Okay. Now, Dr. Gray, is this specific to only women? Do men experience menopause?
So men experience a decrease in their testosterone level, which is their sex hormone, but they don't ever have a complete halt in all of their hormones. So women stop producing all of their hormones. Men just have a gradual decline. Starting at about age 40, they probably lose about 1% of their testosterone production a year.
Okay, now do men experience any symptoms like women? Like, kind of like what we go through?
Okay, so let's talk about the symptoms that women have first of all.
Okay.
So we'll start from head and go all the way down to the toe. So when you start having menopausal symptoms, you have brain fog, you have fatigue, you could have hot flashes, you could have night sweats, you could have mood symptoms, you can have depression, you can have anxiety, change in your skin and your hair loss, you can have decrease in your libido or sex drive, vaginal dryness, and insomnia.
Wow. So when women say, I'm having a personal summer, is that a hot flash?
It is possible. So a hot flash usually starts from the inside. So women describe it as a heat that comes from the inside and comes out to the outside. And it's like a burning sensation that usually lasts seconds to minutes. And it's not something that typically lasts for hours at a time.
Ooh,
okay.
Something like that. Think about it. The first time I had mine's no joke. I put my head in a freezer. And I noticed I was going out during the winter time with no jackets on. And wait a minute, not only that, doctor, I would be having a conversation and people are like, you all right? You're fine? I'm like, sure, I'm fine. What are you talking? Sweat just comes.
Yes,
I'm like,
seeds of
I'm
sweat.
like, what?
Yes.
Yes. Is that normal?
It is normal.
And what about being in the middle of a conversation and you're talking and you just go completely blank? You're like, what the hell was I talking about?
What is that called?
Brain fog.
Oh, see, I had it all the time. So can you kind of talk about that a little bit more?
And people think you're crazy because you're like, I know I came in here to tell you something. I just did it today with Trinity.
Right.
I was like, she's looking at me and she said, what? I said, I came in here to tell you something. I can't freaking remember what it was.
So yes, it's just something. So let's back up for a minute. So the average age of menopause is approximately 51, but you start to have menopausal symptoms usually 1 to 2 years leading up to menopause, and so that's called perimenopause. So you'll hear people say, oh, I'm perimenopausal. So that just means that your hormone levels have started to decrease, but they haven't gotten to zero. And so you'll start noticing symptoms, and then as you approach menopause, the symptoms get more severe. But then there's also another situation where not all women have menopausal symptoms, right? So you don't, every person you know in their 50s aren't having hot flashes and night sweats and vaginal dryness and all these things. And so people come to me and they say, well, I'm menopausal, do I need treatment? And I said, well, it depends on if your quality of life is affected by your symptoms. And some people will say, well, I have no symptoms. And I say, well, glory to God, because there are women who have symptoms, and the symptoms can be very disabling and debilitating. And a lot of people will go to their primary care physicians and complain of these symptoms, and they get put on an antidepressant. And then they'll come and see me and say, you know, I'm having X, Y, and Z, and I went to see my PCP and she started me on an antidepressant. Now, that doesn't mean that you weren't depressed, but sometimes you don't necessarily need an antidepressant. You may just need to have optimization of your hormones.
Oh, wow.
I'm like, you already.
That's awesome.
Wow. Wait a minute. Can I put you on redial or put you on my phone? I mean, this is some great information, because seriously, I knew about my cycle, menstrual, your period, all that. But this nightmare menopause, I wasn't educated. I wish you was around. I'm very grateful that you're here today, and especially in the Black community.
Yes.
You know, for us Black women, we need to know this as well as our men. I think men need to come out of that shell and need to learn about our bodies and what we're dealing with, because they think it's funny a lot of times. Like, you know, she's crazy. No, I'm not crazy. Oh, she's hot. Well, that's not funny when you, like, your body feel like it's on fire.
Exactly.
And I think men should be more sensitive. So if they will learn about our bodies, don't you think so?
Absolutely.
And that's the thing, too. Are men willing to educate themselves on menopause, on what their partner, their spouse is going through? You know, just don't sit there and, oh, she's crazy. Oh, you crazy, you crazy. No, I'm not crazy. I'm sick. Can I say I'm sick if I'm going through menopause?
I don't know that it's an illness, because it's a natural part of life.
So we can't get Social Security or disability.
Okay, so let me ask you this. These symptoms that we have, when we drink alcohol, those beverages, those spirits that we love to consume, what does that do to our menopause?
So then, it's not that it doesn't think to your menopause, but those are triggers for hot flashes. So caffeine, alcoholic beverages, tobacco, spicy food, sugar, fried foods, all the things that people love are triggers for hot flashes.
Now, let me ask you this. And when I have mine, I sweat in the crease of my elbow, around my neck, sweat beads go down my back, and in the back of my knees. What is that about?
I mean, you can sweat anywhere.
It is awful. When I tell you it's awful, it's awful. So one more thing I want to ask you, Deborah, I'm sorry. Can we talk about mood swings? Or what does alcohol do? And then once we jump off of that, I want to go into some of the medications that are out there. So let's talk about mood swings.
Mood swings as it relates to alcohol?
No, as it relates to...
She did.
No. As it relates to us going through the menopause, and we're drinking, and we're, you know, having these symptoms. What is all of this, you know? Because sometimes I can be here, leveled out, right? And then the next minute, after I done had 2 or 3 drinks or so, I'm like on 10. Everybody better get out the way.
Cut her off. I think that's the answer to that question. So maybe she's going to 10 because her hot flashes are even worse when she drinks the alcohol.
Okay.
No, I'm just kidding.
Okay.
No, I mean, you have mood. You have mood instability, or you could have mood instability. So sad moments, or more anxious, or more angry when you have, you know, a depletion of your hormones. And so alcohol just kind of potentiates, you know, some of those symptoms.
Okay.
And one thing I didn't say is that a woman, so menopause is a day in time, right? Where you've gone 12 consecutive months without a cycle. So women will come to me in their 60s and say, I stopped having cycles when I was 50 and my cycle came back. No, baby, your cycle doesn't come back. After you go 12 months without a cycle, you should never bleed again. And if you do, that's not my cycle came back. That's called postmenopausal bleeding. So actual definition, menopause is 12 consecutive months of no cycle. So if you have your ovaries removed, then you become menopausal instantly, right? But if you still have intact ovaries and you go 12 months without a cycle, then that's the definition of menopause. So March 3rd of 2024 was your last cycle. If you make it to March 3rd of 2025, then you're considered menopausal, right?
Okay.
So menopause is that day, and then after that you are postmenopausal, right? So you are past menopause, and the years leading up to it, you are perimenopausal.
Oh, wow.
And then when you don't have symptoms, your ovaries are intact, and you're still having regular cycles, then you are premenopausal. And then another symptom of menopause or perimenopause is that you can start to have cycle irregularity. So your cycles can become more infrequent. Your cycles can become heavier. They can become longer. They can become shorter. Like everything goes in the perimenopause area. In the perimenopause, what am I trying to say? Not what am I trying to say, I just want to get the words right. I tell people will come and I say anything goes in perimenopause in terms of your cycle.
Right.
Okay.
I like that. You know, just listening to you honestly, I want our audience to understand this is some great information. I mean, seriously, your copay can't even pay for this information. This is something that we should share to everyone, because I've heard women, my friends, say, oh, I've been off my cycle 12 months, a little over a year, now I'm bleeding. That little piece of information can change someone's life.
That's right.
You know what I mean?
Right.
And these are things that are so important. So thank you for sharing this, because you have really opened my eyes. And I just love you already. You're going to be my best friend. You just don't know.
So let me tell you something about postmenopausal bleeding. I know that's not necessarily what we're here to talk about, but the reason it's so important for you to understand that once you go 12 months without a cycle, you should never bleed again, is because if you think it's normal, then it could be an underlying problem, and then you don't seek treatment for it.
Gotcha.
So you're 60 and you haven't had a cycle in, say, 8 years, and then you start bleeding and you just say, oh, my cycle came back, and you're having tea with your girlfriends and you're like, oh, my cycle came back, and y'all just laughing and, oh, that's sad, I can't believe that happened to you. But no, that needs to be evaluated, because the most worrisome thing would be endometrial cancer, but the most common thing is something that we call atrophy, which just means that the lining of the uterus gets very thin because you don't have estrogen and it cracks and bleeds. So it's not that we want to always rule out cancer, right? And so because that is a possibility, that's why we want people with postmenopausal bleeding to seek help and not just assume your cycle came back.
Oh, wow, that is so
I mean, for
informative.
Mahogany Tea podcast, kicking off 2025 with some health information like this, y'all can't get this nowhere else.
I'm telling you.
Y'all better check us out, because this is some great information.
It is.
I'm loving it.
Yeah, I have another question, Dr. Gray. I have been hearing women talk about this dryness. One lady, actually, she's one of my high school classmates, she made mention that she was at school working and felt like she had a piece of sandpaper between her legs, and it was just painful. She didn't know what to do. And when I heard her story on Facebook, I was like, oh, Lord, what's she talking about? You know, I'm like, I haven't experienced that. Not saying that I can't. And I'll be doggone, like 2 or 3 weeks later after that, I was walking, I was like, what is that? You know, it was like, ugh. You know, and I'm like, what's the problem? And so can you talk about that? Can you tell us what can we do when that happens? Because that doesn't feel good.
No, it doesn't feel good. So that is called vaginal atrophy. Vaginal dryness, the technical would be vaginal atrophy. And it just simply means that the walls of the vagina, the lips of the vagina become very thin because they no longer have estrogen to cause them to be thickened. And
that's that estrogen, right?
Yep. So things that you can do, of course, you know, there's water-based lubricants that you can try. There is, and I don't know if I can say brands on here, so I won't name a brand, but there is a high hyaluronic
You can
acid
tell us afterwards.
suppository that's kind of been popular going around. And so actually I've been finding that it's been working really well in patients, even better than estrogen. And so then the ultimate, you know, kind of cure is that we can give you vaginal estrogen. And so that's usually in the form of a suppository or in an intravaginal cream. You can also use it and apply it on the outside. But these hyaluronic acid suppositories work really well. And it's not a magic pill. And I tell people that when I'm treating their menopausal symptoms, I can fix your hot flashes fast. In a week or two, your hot flashes will be gone, but your vaginal dryness is probably going to be the longest. longest because we've got to remold the vagina and kind of get things back thickened. And you just think about it like you think about your hair. If your hair is thinning, you don't take a vitamin today and you have thick hair tomorrow. It's going to take months to get your hair back thick. And so the same thing kind of with vaginal atrophy. So we can treat menopausal symptoms, but people just need to know that the vaginal dryness probably takes the longest to fix.
You know, just listening to you, first of all, this can be hard on a marriage too, can't it?
Absolutely.
I mean, can you kind of...
So this is a funny, so this is not funny, but because I'm not making light of it at all.
Right.
But so I went to a course on hormone therapy, and they said, you know, menopause is hard on marriage because the woman's got a bad attitude, her vagina's dry, sex is painful, so she's moody, she don't want to have sex, and she's hot all the time. So I was like, something's got to give. So menopause can be very hard on a marriage. But just know that you don't have to suffer in silence, that there are things that can be done. You can be as holistic as you like, or if you want to be all in with hormones, you know, the sky is the limit. It's just depending on what kind of risk you're willing to take, what kind of side effect profile you're willing to tolerate, how good you want to feel. You know, I tell people I can make you feel better, but then there are things that make you feel better, and then there are things that can make you feel your best.
I love that. I'm so glad you brought up holistic, because I was going to ask you about that. Do you recommend, you know, women take a holistic approach before, you know, taking the big form meds?
So I am a proponent of hormones, but not all hormones are created equal, okay? So maybe probably about 2 decades ago, there was a big study that came out and said hormones were bad. And then all the doctors took all their patients off hormones and women suffered, right? And so since that time, they've now come back and said, well, actually hormones weren't as bad as we thought. But for many years, people were afraid to be on hormones. So I do not prescribe synthetic hormones for my patients, but I do prescribe bioidentical hormones. And bioidentical hormones look like the hormones that your natural ovary produces. And so if you are treated with bioidentical hormone, then you don't have an increased risk of cancer and heart attack and stroke and blood clots and those kind of things. I will always tell patients that it depends on your quality of life, right? So I have people who can't walk from their car to my office door without having severe hot flashes and that kind of thing. Other women will say, you know, I have a hot flash 1 or 2 times a day. If you're having a hot flash 1 or 2 times a day, then I'm probably not going to recommend hormones for you. We can probably try some natural supplements, some over-the-counter things, avoid triggers and that kind of thing. But if you are fatigued, you can't get out of bed, if you're suicidal, if you're anxious and you're depressed, if you can't sleep, then, you know, those are probably people who are not going to benefit from just something over the counter. And so then we have to delve a little bit deeper and say, okay, this is what we're dealing with. Here are your options. And then you have to make an informed decision. My goal is to give you the information, and then you decide what's going to be best for you.
Oh, wow.
Okay, and
I
I think another question somebody wanted me to ask you real quickly. What about vaginal discharge and odors when it comes to menopause? Does that happen during menopause?
So depending on what kind of odor you're talking about, because if you're sweating, of course, sweat can produce odor. But if you are ever having a fishy odor or an ammonia odor, that's not normal, right? So that is usually a pH imbalance, and that needs to be addressed with your physician. But if you're sweating more, you know, then you can have a mustier smell and that kind of thing, and so then that will be more common.
Okay.
So it kind of just depends on what kind of odor you're talking about.
Wow, this was great. I mean...
Yeah, I love it. Lorraine, do you have any questions that you want to address with Dr. Gray before she gets out of here?
I don't think so. Well, maybe one, because I have a teenage daughter, and of course I've just made an appointment for her with you to go over options that she might need to consider getting ready to go off to college, especially in this era where they have taken women's rights. And so what can you say to parents about teenage daughters?
Okay,
Yeah,
so I get this question all the time. When shall I bring my daughter in? So I tell people, so the easiest answer is if she's having a problem with her menstrual cycles, that would be one reason to bring her in. So, I mean, I see patients from puberty through menopause. So my youngest patient is 8. My oldest patient is who knows. And so if a teenager is having problems with her menstrual cycles, cramps, bad periods, irregular cycles, painful cycles, that would be a reason. If your teenager is sexually active, that would be another reason, because we definitely in this day and time want to make sure that people who want to be pregnant are pregnant and people who don't want to be pregnant are not pregnant.
Right.
So then we need to discuss kind of contraception options. And then a lot of times when they're getting ready to go off to college, you know, we don't want to just send them off and, you know, they may not be sexually active, but we have the what if kind of thing. And now you're away from home and we want to make sure that you are protected. So that, depending on family, may be a time. If your teenager is not sexually active, if she is not interested in contraception, if she's not having any problems with her cycles, then you do not have to have your first pelvic exam until age 21, right? And so we used to do pap smears 16, 17, you know, if you had sex,
That's
you got
true.
a pelvic exam, you got a pap smear. So we no longer do pap smears less than age 21. So we do pap smears at age 21. And if you are sexually active, then of course we do screening for sexually transmitted infections once you become sexually active. And, you know, of course, if there's any time that you want to talk about contraception and that kind of thing, then you can always have an appointment. And so I've been having a lot of not only teenagers, so I've had, you know, 18 to 20s and also 50-year-olds that are coming and they're nervous because they're like, well, what is going to happen if they take birth control away? Or I don't want to be 50 and pregnant. And these are valid concerns, and maybe people didn't think about it so much 2-3 years ago, but now it's on their minds. And so I say, well, that's, you know, a good point. I don't know, you know, I never thought that Roe v. Wade would be reversed. So I can't say that birth control is not going to be banned. I mean, I don't think it'll happen, but we don't know. And so I start talking more about long-term reversible contraception. So like IUDs, the implant that goes in your arm and that kind of thing. So IUDs, you can have an IUD for 8 to 10 years. And even teenagers, I've been putting way more IUDs in teenagers than I had, say, 5 years ago, because they're smart and they listen and they're like, okay, if I get pregnant, what am I going to do, you know?
Right.
Where am I going to go and that kind of thing. And so they are listening. They're not, we need to give them more credit than we give them.
That's
and
true.
so,
These
you
kids
know,
are smart.
a
These kids are
long-term
smart.
reversible contraception. So that means that they can have it for 8 to 10 years. That gets them through college, that gets them through high school, through college, and a master's degree. So now they're in their mid-20s, and then they can decide where do we go from here. And then the same thing, you know, the 50-year-old that's still having regular menstrual cycles and doesn't want that 50-year-old baby, you know. It's not likely that you'll get pregnant at 50, but it is definitely not unheard of.
Wow.
And so, you know, we have to.
That is
Can y'all
scary.
imagine me 61 years old with a baby and then on top of that trying to breastfeed a baby?
I'm telling you,
Jesus,
that
that's
is
like a
awful.
Ooh, doctor,
Yeah, that's
you
a
gonna have to
nightmare.
I'm so glad no, honestly, but thank you for educating our youth. Thank you for coming in today. You have like really, when you shut me up, that means I'm just absorbing all the knowledge. And it's so good to see a beautiful black, I mean, beautiful. I'm talking about, I just love your radiant spirit.
Thank you.
I mean,
thank
just
you.
educating us and taking out the time to come out and listen, I mean, talk to our viewers and educate us. For such a time as this, we need it. Okay?
Yes,
So
absolutely.
thank you.
Absolutely. One more question that came in from the audience, and then we're going to let Dr. Gray get out of here. And the people want to know how to get in touch with you. So after this last question, would you please tell our audience how they can reach you, how they can make an appointment and get in to see you? We've been asked to ask you about women that are experiencing vaginal tightness and women that are loose down there. What can they do, or is there anything that they can do?
Okay, so in terms of vaginal tightness, I rarely have people that complain of that, but there is something called vaginismus, where as soon as anything touches the woman's vaginal opening, they have this involuntary contraction of their pelvic muscles, and so it makes intercourse difficult. It makes inserting tampons difficult, and that kind of thing. And so women who have what's called vaginismus have to sometimes have some medical treatments, some pelvic floor physical therapy. Sometimes they may have to have some psychosocial therapy to kind of delve into underlying trauma.
What's the name of it? Vaginal who?
Vaginismus.
Vaginismus. Y'all hear
Y'all know
that?
for my girls in the hood, I got to keep it real. You know what I mean? You want to give us another name?
Vaginismus.
They gonna
So
be
if you
coming to
experience,
talking about
yeah.
say vaginal, I'm gonna say,
But-
excuse me. I just love you. I'm serious. I mean, you're just educating us so well this afternoon. Oh my
Thank you.
God.
But vaginal laxity is something that or looseness of the vagina is something that happens with childbirth. It can happen with aging, and so just kind of depending on how. What part of the vagina is more lax or what part you're unhappy with, there definitely can be surgical and non-surgical treatments. Surgical treatments could include, so some women say, oh, I don't like the way the lips of my vagina look, or my lips are, my labia minora, the smaller lips or the inner lips are bigger than my...
Are y'all really looking at that? I mean,
You would be surprised. I mean, they can
You know
draw it
what?
for you.
No, for real. And I'm glad that you're one of those gynecologists that I hope our viewers get to hear.
And you should look. It's your vagina.
That's what I was going to say.
yeah,
most
I hear you.
definitely.
But how do I know if it look bad, if
Well,
it
wait a
look bad?
minute.
No. It's not a good or a bad. Is it appealing to you? Like, does it look different to you? Does it feel
Sure,
different?
it looks
and
different
stuff?
to us. Look, the
I ain't
older
never seen another one,
I be
so
like,
how do
look,
I
I be like, oh Jesus! And you know, Grandma taught us vinegar. Y'all know, growing up back in
No,
the day.
do not put vinegar
Oh
in your
Jesus, my
vagina.
vinegar.
But well, you know, when we were younger, my mom used to put like a little drop of vinegar in your bath
They
water, a little
did.
alcohol
No,
in your
don't do
bath
that,
water.
Dr. Gray. Wait
She
a
wanted to
minute,
make
Dr.
sure
Gray.
you were clean.
Lord Jesus, I've been using vinegar for 60-something years.
You be drying out your vagina area.
Oh, Dr. Gray.
No, so we don't douche. So I know we grew up and I don't think my generation, so I'm
I
49.
did.
Well, mine either.
I did.
But people in their 60s, I'll say, and up, right? That was something they did. They had those water bottle bags and they
Yeah,
douched and
hanging
they
over the shower, and you like,
Hey,
what
wait a minute,
is
hold
this?
up, y'all. Wait a minute, I'm
What
gonna
is
defend
this
that
thing?
60. I'm gonna defend the 6-year. I had one of them bitch bags now. Every time I got something, I had to use it.
We don't ever advocate for douching. That was old school.
Can you tell us why?
Because douching can change the pH of the vagina, and that can cause abnormal, you remember you were talking about discharge and odor? So people who are douching can get a change in the pH of the vagina and cause bad vaginitis with discharge and odor, and you don't want that.
Well, thank you. Do I have to give you a co-payment today?
You should. You done got a whole bunch of information
I don't have
today.
anything to say. I think I owe you 3 co-payments today. 3 visits.
So, Dr. Gray, tell the people how they can reach you, how you can be reached, so we can get these women right, because we don't want no
But wait a
stinky
minute, are you gonna be
vaginals out
taking
there.
new patients?
So I am taking new patients, but if you call, there is a wait because it's only one of me and thousands of you, okay? So don't be upset if you call and say, I called that doctor on your show and I can't see her till April. I'm telling you now, if you call and it's not urgent,
Right.
you will not see me till April or May.
What's that number,
If
Dr.
you have
Gray?
an urgent problem, my staff will do their best to get you in. So my phone number for my office is 817-473-7172. And I'm located in Mansfield, Texas at 120 North Miller Road, Suite 100.
Well, we
You
might
guys
have to-
get that?
Say it one more time.
That number is, Dr. Gray can be reached at 817-473-7172. She's in Mansfield, Texas, 120 North Miller Road, Suite
100.
I'm gonna have to
100.
get her
Y'all call
office over
Dr.
there.
Gray.
Wait a minute, Dr. Gray. I'm gonna go and tell you right now. I'm gonna be that typical black one call and say, "Hey, I heard you on that show, and I want to see you because my stuff is dry.
I feel like
and
you
my
got some
marriage is
sandpaper
bad."
down
Yeah,
there.
I'm gonna be that with that call. I'm gonna say,
This
Dr.
ain't
Gray,
right.
I'm sorry. You sat right on the side of me, Dr. Gray. You remember me?
But this ain't right, y'all.
Don't say I'm hurting.
But Dr. Gray, we really
Yes,
appreciate
we
you
do.
being here today.
We do.
We cannot thank you enough for taking time out of your schedule to come and sit with us today and educate us on things that, all of us are going through over the age of 50. And I just met one person today that is not experiencing any menopausal symptoms, and I'm just like, wow, lucky you, because I'm over here sweating, I got a whole bunch of stuff going on.
It kind of reminds me from the Bible, but women go through stuff.
We do.
I didn't really realize it until listening to you. It's like a nightmare on Elm Street. Just being a woman, it's a lot. Men need to be more sensitive and nice and loving to us.
They need to educate themselves.
I thought having a baby was something. That doggone menopause.
That wasn't even enough. That wasn't the end.
But I'm serious. I'm so glad to hear this, and I hope our viewers really take this serious, because that dry vagina ain't no good. When your sex life ain't no good, your husband about to divorce you because you nagging, you can't give him none, and even
you freezing him out.
Yes, I put my head in the freezer. Yeah. You kicking your legs at night. You jumping and shouting.
The mood swings, the up down. I can't drink. It's it's a mess.
You be drinking water. You be like about to jump the people. I'm telling y'all think I'm kidding. I used to go to Tom Thumb in Duncanville, and it was like 50 and 40, and people looking at me, ma'am, you not cold? No, I'm not cold. I was not cold, like sweat, and it was embarrassing. You talking to people, and they're like, you just sweating.
Wow.
So I'm coming to see you. Thank you very much.
Okay, you guys give Dr. Gray a call, 817-473-7172. We've had a great time here at Mahogany Tea Time podcast. You guys tune in, like, share, and we'll see you next time.
And
Thank you.
Safe and sexy.
And take care of your vagina.
And save your marriage and go see Dr. Gray. She a hot mess.
Thank you.
That was awesome.
Thank you.
This has been our first live guest, huh?